The National World AIDS Day commemoration is currently underway at the Petrus Molemela Stadium in Bloemfontein. Deputy President David Mabuza, in his capacity as the chairperson of the South African National AIDS Council, is expected to give the keynote address. The ceremony is being held under the theme Equalize and Integrate to End AIDS. eNCA's Moloko Moloto is in Bloemfontein and joins us this morning. Good morning, Moloko. Perhaps in your interactions with some that are gathered there today, how are they looking at this day today, its significance, and in comparison to how far we've come?
Hello, Mfundo Mabalane. Well, maybe let's just give you an update. Indeed, the Deputy President David Mabuza, as the National Chairperson of SANEC, was scheduled to deliver a keynote address here at this commemoration. And unfortunately, they issued a statement, the presidency, that is, to say that the Deputy President Mabuza will no longer be attending this event. They say he is going to be attending to other matters as leader of government business. However, the event will continue with the keynote address, this time around being delivered by the Minister of Health, Dr. Joe Phaahla. Indeed, as you possibly can see behind me, if I were to step out of shot, these are activists, the people who are on the ground, Mfundo, fighting the scourge of HIV and AIDS. But let me speak to Anele Yawa. He is from the Treatment Action Campaign. Molo, just tell us about the work that you do as activists on the ground on the day-to-day basis as we are battling this scourge of HIV and AIDS.
Thank you, and also thank you for having us. The work that we do on daily basis, one, we're making sure that we get into our communities, talk to them, educate them about prevention, why people must always use condom, and also we tell them about preventative measures that are available in our healthcare facilities. But we don't end there. We also go to facilities and monitor the quality of services that is provided to people living with HIV. We also get into communities, door to doors, where we engage with people living with HIV and public healthcare users to find out whether services that are provided to our people are adequate or not. And then in that process, we are able to get stories of the people as to say why they have disengaged from care.
What are they saying, those who are no longer taking medication? What do they tell you?
The majority of the people that we met with, one, they are complaining about long waiting hours in our facilities. Two, they complain about staff attitude. Three, they complain about issues of stigma and discrimination against people living with HIV and other key populations. But on top of that, people are complaining that if you relocate from this community to the other community and you change clinics, if you don't have a referral letter, you are not provided services until you go back to where you were getting services. Others are traveling from Eastern Cape to this province, and it's quite a lot of money for one just to travel from one place to the other just for a letter. Others, if you do not have an ID book, you are not given services. In some instances, people misses appointments and go the following day. When they go on the following day, they are being insulted, they are being ridiculed, they are being made to go right at the back of the queue. These are not standard operating procedures of the department. But also here the problem that we are experiencing is the issue of some staff who have a bad attitude against our people. And then all what we are saying is to say, government, let's sit around the table and come up with a program of sensitizing healthcare workers to respect the constitutional rights and the patient's rights charter, so that when people go to healthcare facilities, they don't feel like one is doing them a favor.
Yeah, let me ask you this, Anele, then, that while we must focus on making sure that those who are HIV positive get treatment, and attention must also be given to those who are not HIV positive yet, in terms of them having to access the pre-exposure prophylaxis, and so that they will not contract HIV as they are sexually active. Do you get a sense, therefore, that government message is clear in that regard? Is it also available readily in our health facilities? Are people aware that there is a medication you can take and it prevents the infection of HIV?
PrEP is available in majority of our healthcare facilities. Stock is there, but what we are experiencing is a low uptake of PrEP. So it actually means that message is not adequately shared with the people on the ground and make them informed as to say what services are available at a facility that speaks to prevention. But also, organizations like ours and other progressive forces on the ground, we have a responsibility to reach out to schools, to young people, where we get them, educate them about PrEP, so that we can be able to create demand. Because if people do not know about the benefits of PrEP, where to access PrEP, we won't be able to create demand. It's only when we do community outreach, awareness and education that will inform people, and this is what we are doing. But also, I think government and other role players have a role. Yeah. We need adverts, billboards that talks about PrEP, which will encourage people to go and access services.
Yeah, and I guess this is also what we are doing to contribute in that regard. But lastly, Anele, we remain the capital of the world in terms of HIV infection. Estimates are that about 7.8 million South Africans are living with HIV, and only about 5 million are on treatment. The rest are not, about 2 million of South Africans. Do you get a sense that at some point we are going to really rein in these numbers and we might just reduce them? What gives you hope?
Firstly, our demand as TAC is to say, in South Africa, all people living with HIV must be initiated on treatment so that we can save lives, more especially during the time of the COVID and tuberculosis. It therefore means that both government and civil society, we need to work together and be honest to ourselves and stop this thing of taking money from HIV, TB conditional grant and invest it somewhere. Money for HIV and TB must go directly to what it is meant for. We have seen in 2020 during hard lockdown, a portion of that budget was shifted from HIV and TB to assist in our response on COVID. That's why we are saying, let's integrate services. Let's make sure that all people living with HIV know their status, they are initiated on treatment in order for them to adhere on treatment, because it is only when people are initiated on treatment and adhere on treatment where we will be 100% sure that we are saving the lives of the people and people are adhering on treatment. But also, even those 5 million plus who are on treatment now, we are experiencing a decline in terms of defaulter rate and all that stuff. So the question is, how do we address this? Step number one is to fix issues of staff attitudes, long waiting hours, and all the issues that we have raised.
Well, Mfundo, clearly the issues there are just so many, and they would require leadership, supposedly from the government, but also civil society in general, because this is a dilemma that we are confronted with, and unless perhaps the suggestions that the people such as Anele, who on the day-to-day basis are engaged in, unless the attitude of those who are supposed to dispense this medication changes, it would appear, as Anele says, we may not win this fight against HIV. We know that the ministry has allocated about 24 billion rand for this financial year 2022-2023 to fight HIV and AIDS in the country. But this is surely not a problem which we can simply throw money at. It would require some form of intervention.
No, most certainly it would. Moloko, thank you very much for that update. That was eNCA reporter Moloko Moloto.